I like ice cream, I like sweets, chocolate. You name it. I have a daughter and a son, but son doesn't care about it because he let me to eat anything I want. He said that is your life, but keep your self-control. But he don't want to be, bossy. My daughter is always, she's bossy.
Because my dad especially is not someone who really wants to change his habits. Like, it's very forced. So it becomes more on you to force that behavior on them where you have to yell at them a lot.
She said she won't let me to eat, she will scream at me, wherever I go she follow me, or if anybody says that I'm eating sweets, she quickly call me and say, control your sweet, don't eat.
Yes, it can be very annoying for him, probably the fact that I'm following him all the time, but it's also one of those things where it's like, it's very necessary. Some people you really have to push. So it started from a family perspective where the family became more so like everything changed from sugar to sweetener. The level of desserts we bought became almost zero. I think it took me about 6 months to realize that the people at the restaurant didn't know that he had diabetes. So they would just actually give him sugar whenever he asked for it. They didn't know. It became to a point where I would be like, do you know that he has diabetes? And then they would say no. So I was like, he can't eat any sugar, don't give him any sugar. And then once they found out, then the actual community got involved.
I won't give up, but you know that there is a lot of control on me in the restaurants, because the minute I walk in, I can see everybody covers the sweet. They said, no, 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 that's not for me. Now I realize that it's not that good, so I have to control myself.
Diabetes doesn't have a lot of symptoms at the beginning. So you feel fine, you're not motivated because you're feeling well relatively. Or if you have symptoms, it's very mild. It's a little bit of a fatigue.
I know that you have to control the sugar, but I don't know what the seriousness of it. But gradually, yes, I learn a lot about diabetic, what we can go through, what kind of problem that we will face. So now I'm a little bit of aware to live with a diabetic is not that easy.
Depending on how long the patient takes to be diagnosed, it might progress into having complications. So they can start to feel numbness and tingling in their feet, which is because the nerves are now getting toxic because of the high sugars is actually toxic to them and damaging the nerves. They might get chest pain because they now have heart disease. So those are quite late symptoms, but depending on when the patient comes in and when they get diagnosed, you can see the whole spectrum from just fatigue all the way to having chest pain and numbness and blurred vision.
I always see that I shouldn't be a burden to anybody, because I have seen that there are diabetic patients, they loses their part of their bodies. I don't want to be dependent on anybody, and I don't want them to think that I am a dependent for them. I know so far I have not gone through anything, but I like to pass it on to my community, my friends, my people, my family. This is one of the worst the disease that anybody can have, the sugar, because that can lead to so many other problems. Our community doesn't talk to anybody about our health issues. I don't know why. Even this is the way that we work in back home. We never talk about it. We feel that we don't want other people to know that we are having. We are not educated well enough what kind of problem, what kind of issues we will face if we go out of control of this diabetes.